Welcome to a deep dive into women's health and wellness. In this episode, we'll explore two common conditions that affect millions worldwide, endometriosis and fibroids. By the end of this video, you'll understand what they are, how they differ, their impact on daily life, and the latest management strategies. Let's begin with understanding what they are. Endometriosis occurs when tissue similar to the uterine lining grows outside the uterus. This tissue responds to hormonal changes, leading to inflammation, pain, and scarring. The most common sites include the ovaries, fallopian tube, and the pelvic lining, whose symptoms often include painful periods, pain during sex or bowel movements, fatigue, and infertility. Endometriosis is not just a reproductive condition. It is a systemic inflammatory disease that impacts quality of life, and diagnosis can take years, often requiring laparoscopy for confirmation. On the other hand, fibroids are non-cancerous growth made up of muscle and fibrous tissues. They develop within or around the uterus and vary greatly in size. They are of four types: intramural, submucosal, subserosal, and pedunculated. To understand all these types, watch our in-depth explainer video on fibroid types available in our Women's Health and Wellness playlist. The link is in the description below. Do you know that some fibroids remain small and unnoticed, while others grow large enough to distort the uterus? Unlike endometriosis, fibroids are solid growth, not inflammatory lesions, and are strongly influenced by hormones, especially estrogen and progesterone. Their symptoms include heavy menstrual bleeding, pelvic pain, frequent urination, constipation, and sometimes infertility. Briefly, let's compare the two. Endometriosis is an inflammatory condition caused by misplaced tissue, while fibroids are benign tumors arising from uterine muscles. Secondly, both can cause pelvic pain and fertility challenges, but their mechanisms differ. On the other hand, endometriosis bleeds and scars, while fibroids grow and press on surrounding structures. Therefore, understanding this difference is important for proper diagnosis. By the way, do you know their impacts on daily life? Actually, both the conditions can deeply affect quality of life. Chronic pain, fatigue, and heavy bleeding interferes with work, relationships, and emotional well-being. These conditions are not just medical, they are social and emotional realities that deserve recognition, because in recent studies, many women report feeling dismissed or misunderstood, highlighting the importance of awareness and advocacy. Next up is diagnosis, which often involves imaging, blood tests, and sometimes surgical procedures, while treatment range from pain management and hormonal therapy to surgery. For fibroids, options include myomectomy, embolization, or hysterectomy. On the other hand, laparoscopic excision remains the gold standard for endometriosis. These choices depend on severity, symptoms, and fertility goals. Medical advances in minimally invasive surgery and medical therapy are improving outcomes and offering hope to many women. In conclusion, endometriosis and fibroids are different conditions, but both deserve attention, research, and empathy. Therefore, by spreading awareness, we can help women worldwide access better healthcare and live long, healthy lives. If you are experiencing symptoms related to endometriosis, fibroids, or any other conditions, please consult a qualified healthcare provider. Thanks for watching. My name is Skylar. If this video helped you understand endometriosis and fibroids, subscribe for more clear, compassionate medical education, and check out our Women's Health and Wellness playlist for an in-depth explainer on fibroid types.